So welcome. I'm Kelly Fox, and I am a professor at the School of Social Work, and I'm also a faculty facilitator and mentor for IPE.
And I'm Elise Parker. I'm the graduate assistant with CECE. And I think it's about time to get started. So our first presentation is going to be student involvement in interprofessional work and perceived impact on future collaboration.
Great. And if before you put up the video, if our participants for this poster session could just raise their hands or give the thumbs up or something so that people know who you are.
Hello, everybody, and welcome to our poster. Thank you so much for coming to visit today. My name is Michaela. I am a student in the Doctor of Pharmacy program, graduating in 2022. I was fortunate to do this research with three colleagues. First is Belle Bogle in the School of Social Work. Additionally, I have Katie Santinello and Will Rinaldi in the College of Osteopathic Medicine. So this is an interprofessional group doing this research, and we look forward to sharing our experience with you. Our poster is titled A Study of Student Involvement in Interprofessional Work and the Impact of Health Professional Preparedness to Collaborate in the Workspace. This poster highlights our belief that interprofessional education has benefited our clinical practice because our experience has taught us a collaborative approach to healthcare. Throughout our study, we seek to understand if our experiences align with those of the broader population. We believe that interprofessional approaches to educating future healthcare leaders and placing an early emphasis on collaborative education can improve the delivery of services and patient care from future providers through enhanced collaboration with other healthcare professionals. Interprofessional education may also reduce interprofessional challenges in the workspace, which can hinder professional practice. The purpose of our experiment is to determine postgraduate preparedness and comfort with collaboration in the workspace, to analyze pedagogical methods of each discipline and the impact of integrated IPE, and lastly, to assess if an interprofessional opportunity improves students' preparedness to collaborate with professionals outside of their respective discipline. Our study questions are the following. 1, how does interprofessional education impact students' attributes in their work or scholastic environment? 2, how does each professional program approach and apply the topic of IPE, and is participation in IPE even encouraged to begin with? Finally, how does participation in IPE prepare a health profession student's future ability to collaborate with professionals outside of their profession? Our methods for the study are as follows. We will utilize the University of New England's alumni network to recruit participants for our study. All participants of our study will have graduated in the past 3 years. We will survey all of these participants to find out how much they were involved relative to each other in interprofessional work while they were on campus. We will also be holding focus groups to try to uncover some larger themes. We will offer financial incentives in the form of electronic gift cards to our participants in the focus groups and an entry to win a gift card to those who are participating in the survey. The focus groups will be at maximum 5 people per group, each led by a student researcher. And we will conduct the focus groups via Zoom and record these encounters utilizing Zoom to generate a transcript. This study is still in progress, so we look forward to sharing our results with you in the future. Please let us know if you have any questions. You can email us at my email. It's mmeyerson@une.edu. Thank you so much.
Thank you so much. That was wonderful. I do have a question, and I would really like to invite all of you who are here to also ask any questions you have. But the first question I have, as a team, what was it like for you to develop a research project, research questions, and a methodology design as an interprofessional team coming from such varied disciplines?
Thank you so much for that question, Kelly. I believe myself, Michaela, and Katie are all on the call. Do you want to start, Michaela?
Sure. Thank you, Belle. And thank you so much, Kelly, for the question. We actually have been doing a lot of reflection about this exact question in the past couple of weeks as we are sort of, entering a new semester and coming to the point of IRB submission for this project. And there were a lot of sort of barriers that we had to overcome as an interprofessional team, especially as an interprofessional team that is comprised of students. So we have different schedules and our programs start at different times and we have different, exam days and like barriers to overcome. So it was really interesting to develop this work. I mean, the work was inspired by previous interprofessional work that we had done in the past. So we knew that we felt that interprofessional collaboration was very important, but we didn't actually anticipate some of the hurdles we'd have to jump over to actually make this project come together. But I think it was really interesting. I know for myself, I've learned so much from my colleagues in other professions. We all approach research and healthcare in such different ways. So it's been really eye-opening and interesting to learn from my colleagues, and just really, it's been a wonderful experience for all of us, I think. And I'll open it to my colleagues if you'd like to answer as well.
Kelly, I'm going to choose to answer this question in a little bit of a different way. In social work, we say person and environment. And so I'm going to choose to really look at it from that lens. And so, you know, I think we're all trained very differently. And so I would never presume that my scope of practice is just like Michaela's from pharmacy, or just like Katie and Will's from medicine. And so when we are thinking about the alumni experience or the future patient or client that we're seeing, and how to hold their experience and what their care needs to look like, and the systems that are in place that that preclude them from accessing care, that was really expressively that was what came up for us when we had these conversations about methodology, access, dismantling systems that were in place. And so when we had those conversations, and if tensions were arising, and they would arise even if we were in the same, profession, we would slow down and have conversations about where there were gaps in our curriculum, in our knowledge, and how we could come to similar pathways together. And so to use a sports analogy, we knew we all wanted to win the game together, and winning the game is accessing care for our future patients and clients, but we all just played different positions on the field. And so leaning into the fact that we all had different training, but we were stronger as a team. And I'll just popcorn over to Katie if she has anything to add.
Oh, I think you guys answered that both beautifully, and I wanted to leave room maybe for a minute for any other questions if there were any.
Any other questions for your colleagues?
I don't have a question, but I'm really looking forward to hearing what your themes are, because as you know, we've just finished a very similar study. And so I'm excited to see how consistent our findings are going to be. I'm also looking forward to seeing the results of the study that you're doing, Shelley, as well as this one, as it sort of, ties in with my own dissertation research. So I'm very excited about this. So thank you so much for your work here and for presenting. And I wish you all well.
Thank you so much.
Thank you.
Thank you so much. Thanks for the opportunity.
Anything else? I think we're just about at the end time here. Okay, well, welcome to all of you. We are just about to start the second presentation. And this is a team, I believe, from IPTI, who will be talking about their experience. And for those of you who are presenting in this poster session, this next one, could you please just identify yourself, raise your hand, or put the thumbs up or something so that your colleagues will know who you are?
Here we go. Expanding our scope through interprofessional care in long haul COVID.
Hello, I am Kelsey. I am here with Arjun, Madeline, Kelsey, and Riley. Our project is expanding our scopes through interprofessional care in long haul COVID. Interprofessional collaboration is an essential portion of patient care as it improves patient outcomes, and in one study has even been shown to reduce readmissions into the hospital. In this project, students of differing professions work together to manage a patient with long haul COVID.
Our patient is a 39-year-old woman hospitalized for 11 days in 2021 for COVID-19. She was admitted to the ICU and intubated. She was discharged 5 days later and spent the next weeks trying to feel better before going back to work. Shortly after discharge, the patient began experiencing excessive fatigue, cough, brain fog, shortness of breath without exertion, hair loss, and loss of taste and smell. She complains that her most debilitating symptom was migraine headaches. She has a previous diagnosis of exercise-induced asthma for 20 years and high blood pressure. She was not vaccinated prior.
Coming from the allopathic medicine and PA point of view, our plan is to examine and evaluate the patient's past medical history and social determinants of health to fully assess the patient's current health status, along with determining appropriate treatment options. Our assessment, the patient seemed to have been experiencing headaches that were limiting their daily routine, a cough, and really have been struggling with getting enough sleep and feeling exhausted. The patient really seemed distraught and frustrated with the symptoms. The biggest frustration seemed to stem from the patient feeling as though no one was understanding how difficult the situation was for them, the financial burden they were undergoing, and not being able to provide for their children the way they want.
From a pharmacy perspective, I evaluate the patient's medication list and their past medical history. I want to make sure each medication has an appropriate indication. I also check for drug interactions to make sure nothing on the patient's medication list nor their diet interacts with any of the medications they are currently taking. I also evaluate the patient's complaint list to make sure that none of their complaints are a potential side effect of any of the medications. If a medication was causing a side effect that the patient didn't like, an appropriate recommendation would be made to the allopathic medicine student or the physician assistant student.
The plan for occupational therapy was to evaluate the patient's strengths and challenges to occupation in the context of values and motivations, roles, routines, and current environments. The patient reported no feeding or eating difficulties post-intubation, but did report feeling fatigued and short of breath after ADLs and IADLs. Specifically, the patient felt they couldn't fulfill the demands of a full-time job and providing care for 2 young children. Despite these barriers, the patient's strengths lie in her motivation to change. Occupational therapy recommended walking to decrease stress and increase cardiovascular endurance, utilize energy conservation techniques, and increase community mobility by ride sharing. Education interventions were utilized by the entire team to increase awareness of current COVID-19 evidence.
In conclusion, an after-school program was suggested to help look after the children during the day when both parents are at work. Support groups were mentioned to help the patient know they're not alone and validate their feelings. Propanolol was recommended for headache.
Perfect. Thank you so much for your presentation. And my name is Kelly Fox, and I'm the faculty conversationalist for this session. This is an opportunity for you to ask any questions that you might have of your colleagues.
Yeah, thanks. Great presentation. So my question to you is, since all of this is new, what was your process in terms of, you're all coming from evidence-based practice perspectives, and all this is new, right? It's a new thing. Long COVID literally was evolving and the terminology was evolving. And I'm just sort of asking what guided your decision-making about, things that you were recommending and how you approach that, because literally the information that people were getting, there's false information coming out. You're trying to go by the best science that's coming out at the time. And this was all happening in real time. So I'm just kind of curious how you sort of approach that from a team perspective and made collective decisions, and just sort of how you orchestrated that, as all of this was evolving in real time.
That's a great question. And we had some conversations with our client and our client's family, and they had questions about what were the repercussions of long COVID and when am I going to get better? And unfortunately, we had to tell them that we did not have all the answers. And I think that can be hard to tell someone as a health professional, but also to hear. So we talked a lot about navigating through those kinds of conversations. I think in terms of occupational therapy, it was more, my recommendations were more centered around where the client was there and now and what they were struggling with. And so one of our patient's biggest things was her energy and just not being able to keep up with the things that she did every day. So just recommending things, small things that maybe not are directly related to COVID-19, but are going to help her get back on her feet and do the things she needs to do every day, was kind of what I geared my recommendations towards.
Any of the other team members have anything to add to that?
I pretty much echo what Maddie was saying, in that we really had to take into account like the patient and the family's feelings about the situation and long COVID, and hearing that the healthcare professionals don't have all the answers can be hard for the patient. I am a pharmacy student, so when I was looking at her history, I was looking at the medications that she had, and I was taking into account how much are those costing her, because she was, both the husband and the client were very concerned about money. So thinking about how cost be cut down in that sense was a part of what I was looking at as well.
Thank you. We have just a couple of 30 seconds left, but I'm just curious, what surprised you the most as team members in working collaboratively?
I think one of the things that surprised me the most is how much our professions overlap with each other. And I think on a quick note, we were a team of 7 that dwindled down to a team of now there's 3 of us. So we, with all those overlapping themes, we really had to figure out how we were going to navigate all the things that are not maybe directly in our scope so that we can address this client holistically.
So I think that is our time, and I think we're about to welcome our next group in. So thank you very much for your presentation. Well done.
So once again, if anyone needs to move, feel free to do so. We're going to get started in about 30 seconds.
So welcome to the scholarship track here. I'm Kelly Fox, and I'm a social work faculty, and I'm going to be facilitating the conversation.
And I'm Elise, and I will also be here helping to facilitate and keeping things moving. Our next group is going to be dismantling the hierarchy in a professional collaboration for best patient outcome. If this is part of your group, can you just go ahead and give us a hand raise or some type of emoji to let us know you're here? And without further ado, here we go.
Hello, everyone. We are the Holistic Whales. This is our poster, Dismantling the Hierarchy, Interprofessional Collaboration for Best Patient Outcome. Our objective is to utilize interprofessional team collaboration to develop skills to create the best plan of care for our telehealth patient. We are a group of health professional students from different programs working together to create a holistic plan of care using motivational interviewing, including our patient's family, into the decision-making and using a multifaceted approach in order to address all aspects of patient care. Our patient is Amanda. She is a 39-year-old female who was hospitalized for COVID. After she was discharged, she began experiencing symptoms of long-haul COVID, and she was referred to us. She has a partner, Mo, and her 2 children, Karis and Bennett. Her goal is to find out why she is still having symptoms, to address her fatigue, headache, and stress, and to find a better way to feel better and back to herself.
For our interprofessional goals and collaboration, we were able to engage in realistic patient interaction while also participate in active listening and motivational interviewing with both our patient Amanda and the teammates. We learn how to balance multiple professional perspectives to help the patient navigate their stigmatized condition.
During telehealth session 1, we practiced motivational interviewing and asked guided questions to create a better understanding of Amanda's current and past history related to her diagnosis as an interprofessional health team. Through this process, we validated Amanda's feelings and legitimized her long COVID diagnosis while developing a treatment plan.
In session 2, we used the information gathered from session 1 to create recommendations in our interprofessional team. And we also included Amanda's partner, Mo, in the decision-making as well.
Each participant had their own takeaway, but our large conclusion was that we felt lucky to be placed on a team where each person felt knowledgeable, respectful, and motivated. There were key factors that we prioritized in order to best achieve the outcome for our patient. All participants worked to better understand each other's profession, asking questions regarding their scope of practice and how we could best support the other or fill in gaps. We genuinely approached each person and their profession as an asset, not an obstacle. We worked to understand each profession's approach and that each approach brings valuable information to help our patient holistically. Most importantly, we remembered that our common goal was to help Amanda.
Well, thank you so much for your presentation. Well done. I'm wondering if there are any questions from your colleagues in the room here. I have a question. I'm curious about the title, Dismantling the Hierarchy, and I'm curious about what you learned about how hierarchy plays into perhaps obstructing good patient care, and what dismantling the hierarchy meant to you as a team.
I can start off with answering that. So our big thing that we found and that we were pleasantly surprised about was that there was no one person that really took over leadership. We all took turns taking on that role as we saw fit. And so one of our teammates who isn't currently here with us today presenting the poster, she was a social work student, and she specifically stated that oftentimes she feels overlooked in her profession, and that she was really glad to see that we put her at the forefront. Like, we really valued her opinions. And the other thing that we found was that there wasn't one specific person that took over for recommendations. Like, it was a collective whole. Like, we all came to agreement on what we wanted to recommend to Amanda. And so that was really great to see.
Yeah, going off of that, what we really strive to do all together was kind of find those similarities between each of our professions and then work together to build those. So as an occupational therapist, Hannah and I worked really closely because Hannah's a physical therapist, similar with Claire and Diana, who's a PA and a comm student. So we just really took all of our strengths all together and cultivated it to support our client.
Claire, anything you'd like to add?
How did you know? I apologize. I think specifically this case was set up really well to help us remember or to remind us or kind of initiate relying on each other. I know that I personally really wanted lab values, and I think my teammates can tell you that. And I think when we look at a patient specifically in terms of numbers, what are her numbers doing? What are her labs looking like? We forget our patient as a comprehensive person. And so I think that really helped put Diana and I on the same level, if you will, with our PTOT and social work co-workers, because we are all a team and we weren't just trying to fix her, we were trying to improve her quality of life. And I think that, again, working with such a dynamic and impressive group of people, we will really able to kind of rely on each other and pass back and forth. It was very collaborative overall.
Thank you. How about you, Diana? Anything you'd like to add?
I just found it really interesting that working with like a group of interprofessionals, like a lot of the things that are commonly missed during normal doctor's appointments. And I really liked our group dynamic, that how we didn't really like talk over each other. We had a common goal at the end of the day. So really like that.
And Carmen, is there anything you'd like to add?
Yes, there have been many instances on a day-to-day basis work where I have felt like I would like to do more for my patients. And this kind of opened that window for me where I know where I can go now for extra help. So that has been my biggest takeover from this.
Thank you. Anyone else in the room have any questions? We're actually just about out of time. So thank you. Oh, go ahead. I'm sorry.
Sorry, I just wanted to ask if each of the participants remembered a moment in the activity when they felt their own confidence in their own profession increase.
I can touch on that really quick, and not to speak for everyone, but I think something I know I personally gathered as an OT was there was the moment where my profession is important in this role. And so we each kind of got our own highlighted, like, this is how I can support, and this is how I'm going to best support our team and our client. And so I know that's how I felt personally. I'm not sure about everyone else, but I think it was a common ground.
Thanks. I see some head nods. Hannah?
For me, during the first session, so I wasn't one of the ones that was directly like in the room with Amanda. Like, I heard them talking about like her being tired during work, and so that sparked my idea of like, well, how often is she resting? Like, is it relieved when she rests, or like how like fatigue and endurance wise for a PT perspective? So then I came in for the second session and addressed some of those things.
I think that's a great take home from IFTI. Thanks.
I'll just add one thing more about the interprofessional portion. I think I learned a lot about Amanda and how I could help support her and my teammates by listening, by sitting in on those other interviews, kind of like Kristen and Hannah were saying, like, oh, that triggered something for me about how I can add. And that was really exciting for me as the person new to the profession.
Well, thank you all so much. I really appreciate your conversation here. And I think we have to move on to the next video. So thank you so much. Well done.
Thank you.
Okay.
Excellent. So if our team members for this presentation could please just raise their hand or give a thumbs up or some icon to let us know who you are, that would be great. And I'm Kelly Fox, and I'm the faculty facilitator, and Elise is our student facilitator.
The next presentation is Westbrook Housing Authority Educational Seminar Series.
Hi, everybody. My name is Marima, and I'm an OT student at UNE, and I'm representing the Westbrook Housing Authority Educational Series poster for my team. My team members include Erica, a PT, Alex, a PT, Angela, an OT, and myself, an OT. My team, some background information from Westbrook Housing includes that the Housing Authority provides affordable housing for families and adults over the age of 55. Currently, there are 555 affordable housing opportunities for seniors living throughout Westbrook, Maine. We can thank Tom Muser for establishing this connection with Westbrook Housing residents through the UNE's Center for Excellence in Aging and Health. Tom and his staff worked hard to perform a needs assessment and create events that would be meaningful to the residents at Westbrook Housing. This was when the Westbrook Housing Educational Seminar Series was created with various wellness topics that residents would be interested in, which include pain, balance, nutrition, goal setting, use of adaptive equipment, and technology use. There was a collaboration between PT and OT students for each educational seminar to create well-rounded representation for the residents. We have learned that collaboration is key in developing our future careers, as we will work closely together to improve patient outcomes once we enter into our professional fields. We have found that the best patient care models are through transdisciplinary care models, and this has allowed us to provide our residents with well-rounded presentations that apply to their everyday functions. After completing the first seminar on pain management, the residents were super interactive, and we wanted to provide them with something more. So we created the Westbrook Housing Authority mini grant to fund different wellness prizes to provide to residents following the seminar. The goal of these prizes was to promote healthy habits among residents and continue to increase attendance from the Westbrook Housing Authority residents. We have had 3 presentations in total so far, and will continue them into the spring semester. We are so thankful we can establish a connection between the residents of Westbrook Housing and the therapy departments this semester. We hope to continue to provide services in the future and continue to provide more services in the future. We want to thank all the PT, OT, and social work faculty that have established and supported this project. This project was funded by the Centers for Excellence in Collaborative Education. We want to thank the Office of Research and Scholarship and Brian and Deborah Dallaire for their ongoing support. We would also like to thank the Pharmacy Department and Tricia Mason for contributing resources to the Westbrook Housing Authority grant. We would also like to thank Chris Hall and Michelle Coe for assisting us throughout this process. Again, thank you so much.
Thank you very much for your presentation. That was great. And I'm just curious, is there anybody in the room who has any questions for our presenters? I have a question. So what surprised you the most about this collaboration? And is there any member of the team that you wish you had?
So I can answer that. My name is Erica. I think the biggest surprise for me was understanding a different perspective, because in physical therapy school, you learn how to be a physical therapist, you learn how to help in that aspect, but it was really neat to hear how OTs help also in the same aspect, but in a different way. So it was really cool just to have the interprofessional interaction to help us gain more knowledge of different professions. In the future, we would love to have more interaction with other students from pharmacy and medical, but at this time, because we're starting to get it going, we're just sticking with PT and OT.
Anybody else want to respond to that?
I can add to that. I agree with everything Erica said. My name is Alex. I'm also a PT student. Unfortunately, we don't have any of our OTs here today. But I think in the future, bringing in pharmacy, social work, pretty much all the UNE professions, we could see great growth in this project. The residents are super fun to work with, and they have so many great questions for us and make us keep learning every day. So it's been a great project.
Great. So we have a question in the chat from Dr. Cramsey, anything related to the grant writing for this mini grant that you anticipate bringing with you into your practice? And do you have any advice for other students pursuing mini grants through CECE?
That is a great question. I feel like by collaborating and writing this mini grant, it helps me tremendously to understand the importance of actually collaborating as a team and taking like a leadership role in a roundabout way to help so things get done right. I think for the future to help other students it's worth it. It's a lot of hard work, but seeing the joy that it brings to our grant, the grant that we have, it brings to the residents has really helps me a lot to realize that I'm really glad I wrote the grant to help them, but it also helps me to be more professional in the future.
I would also add that throughout the grant process, we definitely had a lot of mentors, faculty mentors. Dr. Cramsey was one of them. So it was super helpful to reach out to them as well and just keep getting feedback on what we can improve and kind of work as a team to figure out how we can make the grant accepted.
Thank you so much. And Elise says, as someone who participated in the Westbrook Housing Project, I just want to highlight how wonderful of an opportunity it is for older adults. There was so much socialization, laughter, and education gained from the session. Thanks for that addition, Elise. Anyone else? I think we're just about, I think we have to move forward now. So thank you all for being here, and thank you for your wonderful presentation. So for those of you who are our presenters this time, if you could just put up an icon or raise your hand or give us a thumbs up to let us know who you are.
So our next group is Ghana Cross-Cultural Health Immersion Medication Label Redesign.
This is our project. It's called the Ghana Cross-Cultural Health Immersion Medication Label Redesign.
Hi, my name is Lisa. I'm a P2 student at UNE.
Hi, my name is Sarah May Rose. I am a second-year pharmacy student at UNE.
Hi, my name is Megan Larson, and I am a public health student at UNE.
And I'm Shannon. I'm a pharmacy student. I'm a first year. We also want to thank Dr. Saeed Wasti and Emily Hand, a nursing student, for also participating in this project, and Dr. Rachel Mayer and Jennifer Seedy for being our mentors. And here's just our presentation outline. We're going to go through the background, we're going to go through the audience, the products that we produced, and our next steps. And I'm going to hand it over to Lise to get started.
We found out that health literacy and health communication is a major concern in many cities, town healthcare cities in Ghana. So we're going to go over some audience. So for the audience, Ghana has some patients and healthcare workers. It has urban, but 79% completed primary high school.
So the product that we designed was a medication label for prescription medications that patients take home with them. And we implemented various implements from the previous label and then used some feedback from some community health workers from Ghana that we met with. And then what we concluded from that was pictures were better than text overall, and then numbers were better than just written instructions. So 2 times 1 versus take 2 tablets once a day. And then that previous medication label right there is what we built our new label on.
Based on the feedback that we got from James and Richard, who we connected with from Ghana, and then using the knowledge that we gained from our schoolwork, this is what we came up with for the updated label. Just moving things around and making minor but effective changes. And to implement the process change of using the label, we did the needs assessment of the community. We researched, developed the implementation, the new label. Now we got to implement and evaluate the impact. We developed some community healthcare training, community healthcare worker training that will be used to allow the community health workers to become content experts on the label.
So the evaluation tool for healthcare workers that we developed is based on a 26-point scale. And based off the score, we either need to re-educate the healthcare provider, and depending on the distribution of those scores for all of the healthcare providers, we either need to change our label or it's considered successful. And this is the patient usability tool we developed. It's got yes or no questions, and basically the healthcare provider scores it to score the patient's understanding. These are our references, and we are wondering if you have any questions.
Thank you. Are there any questions from people in the audience?
So that was awesome. And as I, was listening to your presentation, it's very much a design thinking process. The parents to mind where you iterated on, in terms of what would work, and you were evaluating in real time. How does this work? My familiarity with the Ghana program is we're there for a brief amount of time, and the ability to have impact, sustained impact over time. So what are your thoughts about, something like this that continues to improve? Is it now the casework, the case folks that are actually on the ground that have the skill set to be able to continue to further improve on? I mean, it's awesome what you created. And I'm wondering, sort of the ongoing evaluation and quality improvement thing. So how does that work in a program like this?
I think from my understanding, I think the ongoing improvement process would still be a collaboration with the University of New England in conjunction with the community healthcare workers, using specifically what we developed, the evaluation tools, to hopefully give us a snapshot of how the updated label is working for the community. And we did do like a percentage criteria. So based on the results from the evaluation, there would be re-education for the patients or the community healthcare worker, whoever is having the evaluation, or if the results are unfortunately low enough, that would then trigger the label to be sent back to UNE for further evaluation for future students. So I believe what the plan is to have the label evaluated with the evaluation tools, go back, that information will go back to the cross-cultural program, and then it will be evaluated if things need to be improved upon again. Still going with the same framework of this go round with UNE students working with community healthcare workers.
Is there a mechanism for sustained communication across the year?
That I don't know, unfortunately.
Yes, I think Dr. Jen Morton and I think Tricia Mason are in communication with the folks that we collaborate with in Ghana on a regular basis, from the University of Cape Coast, as well as the folks on the ground in Takoradi and Sekondi. Any other questions? So I'm curious about how it was to collaborate across disciplines for this project, considering that you all weren't pharmacists, you all weren't public health people, and this was a cross-disciplinary experience or interprofessional experience. I'm curious what that was like for all of you.
I can start off by just saying that I thought it was really interesting to kind of see it from like two different perspectives. From a pharmacy perspective, for me, I was more focused on the actual like drug information, while from a public health perspective, it felt like a lot more of a macro look at everything, of like investigating exactly how the label worked and how effective it was in the population as a whole versus just for each individual patient, was just kind of like really interesting for me. I know Megan, you worked a lot on the evaluation tool and everything, and I thought that was really interesting for me anyway.
Yeah, I found it was a great experience. I do think that this particular project really suited an interprofessional group really well. I think that for public health, we want to improve the health of the world or a whole population, and our focus more on preventative measures. And then I think the pharmacy perspective was great to have, just because of what we were working on, the prescription label, making sure that we had all the necessary requirements on the label itself, and then nursing too, with the aspect of patient care, is really important to make sure that we consider that as well. So I really do think that this particular project worked really well with our group.
Well, I think our time is done for today. There is a link for the attendance in the chat box. Thank you all for your presentations, and for all the great work that you're doing. And I really appreciate your taking the risk of working interprofessionally and learning what that's all about. So thank you very much.